Today we are having our long-awaited bowel cancer seminar, and we have Dr. Alistair, who is the consultant gastroenterologist, West Herts Hospital Trust, and we have the pleasure and the honor to have him in our midst. He's given up his time to come and talk to us. So please let's welcome him with a round of applause. And we also have Olabisi. It's another Olabisi, who is bowel cancer screening nurse from West Herts Hospital Trust.
Thank you, Olabisi, and thank you, everyone. If I got that warm a welcome whenever I got up and spoke to people, I'd be a very happy man. And thank you for giving me the opportunity to spread the word about bowel cancer and bowel cancer screening, because sadly bowel cancer is under-recognised. The population in general doesn't come forward as often as people should with symptoms of bowel cancer, so for that reason diagnoses are delayed. And also I think we feel that although we do quite well in West Hertfordshire in terms of the proportion of the population who are taking up the bowel cancer screening programme, we could still do better, and we have some data to suggest that in certain groups, certain ethnic groups and certain socio-economic groups in the population, the uptake of the bowel cancer screening programme has not been quite as good as in maybe more affluent middle-class white groups of people. So just to paint the picture, just to start with, go down? No? There you go. Oh, no, hang on. Excellent. Bowel cancer is the third most common cancer in the UK. That's after breast and lung cancer. But lung cancer is on the decrease as a result of people not smoking as much. So it remains a very important cancer. It accounts for almost 35,000 deaths, new cases per year. That's one new diagnosis every 15 minutes in the UK. It's the second commonest cause of cancer death, so somebody who's dying of bowel cancer every 30 minutes. That's 16,000 deaths per year. 1 in 20 of us, approximately, slight sex differences, can expect to get bowel cancer during our lifetime. And it is a very, very treatable condition. So if we catch it early enough, surgery will more often than not be curative. So survival depends upon stage, and it depends upon people coming forward with their symptoms, or even getting a diagnosis before symptoms develop. And so that's the purpose, really, of the screening programme. We know that our bowel cancer screening programme will reduce the likelihood of death from bowel cancer in the screened population by 15%. So potentially we can save in the UK 2,500 lives a year as a result of this programme. So that's with cure. Just a reminder, as the purpose of the screening programme is not to catch people who have symptoms. If you have symptoms, you should be going to your GP and seeking investigation anyway. The screening programme is for people who have no symptoms at all. But just a reminder of what the symptoms of bowel cancer might be. It's a change of the stool frequency to more frequent, or a change in the consistency of the stool to looser. So perhaps diarrhoea symptoms really is the simplest way of saying it. Blood in the stools, weight loss, and anemia. So it's those big four. Now in my clinic I get quite a lot of worried people coming to me with tummy pain, thinking they've got cancer, but in fact tummy pain is a very rare way for bowel cancer to present, and usually some of these other symptoms will come first. The sad thing is that although we are doing a screening programme, and it's meant to be for symptom-free people, a lot of people when they come up to Lizzie's clinic, when she asks them questions about these kind of symptoms, a lot of them already have symptoms, and it would be nice if we could get people perhaps more people to come forward before they actually have symptoms taking part in the programme. The Duke staging is a staging score. It hasn't quite come across there. It's basically Duke's A, B, C and D. Where D is bad, that's a more advanced cancer, and A is very good, that's where the cancer hasn't started to spread through the bowel wall. And if you can catch it at that stage, you've got up to a 95% chance of curing it, according to a 5-year survival. But if it's already spread to other organs, it's almost impossible to actually cure the condition. If we wait for cancers to become symptomatic, we find most of the cancers are presenting around about stage C, B to C. But we know that with a screening programme, we can push that towards the earlier cancers, so that we get more polyp cancers, which are really the earliest form, more Duke's A's, more Duke's B's, and then the C's and D's are much less common. This is a graph really to emphasise that bowel cancer is a condition of old age. So as one gets older, the condition becomes commoner. And this is one of the reasons why the bowel cancer screening programme has been focused on the over 60s, because 85% of people with bowel cancer are over the age of 60. So it goes up and up and up until you get to 80, and then after that it begins to diminish again, because of course we all know that by the time you're 85, you're indestructible and you're basically not going to die of anything. This is the third national screening programme for cancer in this country. The first two came out under a female Prime Minister in 1988, which is the cervical and breast cancer screening programmes. This is the first one for men. So, bowel cancer really started being rolled out in 2006, and why, you may ask, has it taken almost 20 years to roll out another national screening programme? The screening programmes are difficult, they're very expensive, you have to get them right, you have to make sure that you overall do good, and there's no point in spending a whole load of money on screening people if you're actually going to cause more problems than you actually solve. So there have been some difficulties getting bowel cancer screening up and running, but it is now very much up and running. The programme has been rolled out since 2006. 2006 it was just a few centres, almost test centres around the country. We got going in 2008, we were one of the earliest second wave centres to get going, and now, as you'll see a little bit later on, most of the country is covered, so it's rolled out slowly across the country. The reason for that is that the centres that do the screening have to meet very, very strict criteria in terms of meeting waiting list targets, in terms of the quality of the procedures that they can offer, and also they are now very closely vetted by quality assurance programs. Again, it's to make sure that we don't end up actually doing people harm rather than good. The difference between a screening programme and, say, any other healthcare is that any other healthcare, a patient comes to you with a problem which you then do your best to try and sort out. Whereas with the screening programme, you have a completely healthy person with no complaints who you're then doing medical things to. And you've got to be very careful not to turn a completely healthy person into an unhealthy person unwittingly by what we're doing. Essentially, the programme involves a special test, which is a stool test that's sent out every 2 years to the 60 to 69-year-old age group. And the test detects minute traces of blood in the stool. The reason being is that bowel cancers can intermittently bleed, and then that's what you pick up using the test. The test is done at home and then sent off to a centre where they're analysed. And if the test is abnormal, the person is then booked into a screening centre to have an appointment with one of our SSPs, usually Bissy, who does the majority of the work in West Herts. Around 90 centres in the UK, your local centre is Hemel Hempstead General Hospital. Usually the result of that is that you're advised to have a colonoscopy, which is a telescope examination of the bowels and look at the bowel cancer. This is the country as it stands at the moment. You'll notice that Scotland and Wales and Northern Ireland are not on that map. They are now devolved and consequently are doing their own thing. But just looking at the England our cancer screening programme, we are 98.4% covered in the country now. The only ones that are lagging behind are Oxfordshire, which are on the way to being rolled out, Swindon, which has nothing, and the Isle of Wight, which still doesn't have a screening programme. And we're somewhere, I think, around about there. Looks small, but a big population in this area. That's the screening centre, that's Hemel Hempstead General Hospital as it used to be. I started screening there in March 2008, and we've now been going 2 years, which being as the screening programme is on a 2-yearly cycle, it means that having completed 2 years, everyone between the age of 60 and 69 should be invited, has now been invited, and we're now getting round into a second round of invitations. There's a few more pictures of the unit. That's the reception at the endoscopy unit. There's a few of our very nice nurses on the endoscopy unit there. So, if you're interested in taking part in the programme, how do you go about, what do you have to do? Well, nothing, because the test will be sent to you. If you're registered with a GP, your details will have been passed on to the screening hub, who will then know that you're in the eligible age range, and it's usually, because of the way we chose to run it, around about your even number birth rates, so 60, 62, 64, 66, 68, and then we have to catch the 69s at the end. So around about that time, the hub will send out an invitation. You're not allowed to be ageist, so if you're 70 years or older, you can ring that number and they will send you a kit, but you won't be sent on automatically. The hub, first of all, the hub is in Nottingham. They deal with a whole chunk of the country, our hub, but they also deal with other screening centres. And they first send out an invitation letter inviting you to take part. Now, if you don't let them know that you don't want to take part, a week later you will be sent the test kit, which is the stool test kit. Although kind of dealing with poo is obviously a bit messy and a bit unpleasant, the advantage of this is that you can do this in the privacy of your own home. And later on this year we'll be showing a video of the practicalities as to how to actually do the test. 98% of people, the test will be negative, and that will be the only contact they will have with the screening programs. They'll send their stool off, and then about a week later they'll get a form back saying, everything's normal, don't worry, please do take part in our screening program again in another 2 years' time. 2% of people have an abnormal test, essentially meaning positive, and as a result of that they're told that they have this abnormal test and they're booked in to see one of our specialist practitioners, such as Bissy, in the clinic within the next 10 days. Now obviously at this stage, the person receiving that is very, very anxious, so hence the reason why we want them seen nice and quickly so that they can perhaps have their mind set at rest and move on to the next stage. This is going to show you some stuff to do with this. This is the screening test kit. It comes on a bit of card. It's got 6 windows. You're given those spatulas, which are known as poo sticks, which you can get started with your stool, you rub on the various windows, and then you seal it all up, stick it in an envelope, and send it off to the hub.